Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to continue picking up where we left off last week with orthodontics of the future. These are this guy had a total upper arch expansion in there, where his upper arch went inside. In other words, all of his upper teeth went inside the lower teeth, like that. And we pulled it up, put a block out here, and widened the upper arch out. And you can do that on anybody. I don't give a darn how old they are. You can expand their arches. You can do all these movements of the teeth that I'm talking about. And I don't believe that there's any real basic movement that you can't do except separate the suture on somebody that's 40, 50, 60. Some of the 40s we've done separate the suture. But you can expand the arch at any age as long as a person is alive. And you can do these things orthodontically, and it's impossible to go in and surgically do this. You just have to cut the maxilla up in pieces to get it out there. And you can put gentle force on these teeth and move them out almost any way you want to. You bring the roots out with them and give them more airway, all sorts of ways like that, by putting the rectangular wire. And I showed you how to put this buccal root torque on the teeth, upper and lower teeth. And so watch what we do with this. I've shown this case before, but not talking about it with the idea of this is the way people are going to do orthodontics in the future. You can write it down. That's what people are going to want have done. And then the way we charge for it is ridiculous now. And so whatever you do, there'll be a different fee, like fixing your car or anything like that. So you cannot take an arch and close it surgically without cutting the teeth all to pieces and moving it and letting them grow back. Let nature do the movement of the teeth. You just put a gentle force on them, and you can take the teeth almost anywhere you want to and bring it. And watch this case, and I'll show you that. So let's get started here. Get going. This guy came in. He's looking up into that picture. I didn't have the picture of his face starting off. Now this is his teeth. He would close to it. He's up about 50-something years old, and his lower teeth close outside of his upper teeth, all the way around. Now, when he opens his teeth, look how these teeth are worn off here. Right there, they're going down on these upper teeth, they're ground down sharp. If you stuck your finger in his mouth here, it looked like his teeth are sharp enough you could just bite it in two. And he can close and bring these teeth together down here. Now, what we're going to want to do is raise these teeth up. And we want to take these teeth down. And while we're doing that, we're going to widen this arch out like this. And I say it, we're going to do it because I know I can do it. And you may see people that say, well, that can't be done. You can't surgically go in and move these teeth around and have them fit as nice as this will go to fit when we finish it up like that. It is impossible. You would have to cut these things down, but we can put these intruding wires and bring these teeth down. Put them, raise these teeth up. Pull these teeth to go down. When these go up, this will go down. These will go up, well, these will go down right here. Now, watch that take place. And this is why I say this is the orthodontics of the future. This is what people will want done to their teeth. And there's so much of this out there that I don't care. There's not enough orthodontists in the world to go in and treat all the adults that are like this, and they want their teeth to look better, and they want to be able to chew better with their teeth. They want to keep their teeth. And I've been around on many of the different countries in this world, and I've worked on people from many of them, and I have never found a human being that wanted to look ugly and that wanted the teeth all screwed up like that. People want this, and we're putting it out there, and people will demand that it be done. They're going to find out. I get people writing in or calling. I mean, I can't answer all the requests. Who can do this for me? So let's watch what we do it, and I'll show you how it's done, but somebody's going to have to learn how to do it. So here, when he bites, he goes there. He opens, he goes there. Now, you look at this and you think, you can't move and put these teeth, even if you cut them apart together. And this Invisalign stuff, it brings people in that need their teeth done. That's the only really good thing about it. You can line up the front teeth here, but you can't even begin to do a case like this. Now here's the upper arch. See how small this is, like this. Now the lower feet fit on the outside of this upper arch right there. Now I went in early in the case and just bonded a deal on the front up here. Now that puts him eating on the condyles will be up against the fossa right here at the back, and it touches back here, and it touches up here, and sometimes a person's temporomandibular joint is not healthy enough to take this, and so you have to put a little block back here at the back of the mouth to take the pressure off the joint. But he didn't bother him at all. And so we open the bite. Now we're spreading the upper teeth out. You can see these going out like that. Use a large wire to do it. You can put some buccal root torque and bring the teeth out. And the buccal root torque carries the teeth out, pushes the tips of the teeth out. But if you didn't have the Big Daddy or this large wire pulling it down, now we've got an intruding arch. We'll come back with the other one and widen in addition to that. You just put gentle pressure moving these teeth, and the body will just move the bone and the teeth and everything in that way gradually to a certain position, and you can pick out where you want them in that way. Watch that. Now you've got to end up with the same pressure on the inside and the outside, so you have to do a little retention in that respect. All right, we're spreading this out, and I'm opening these spaces where you didn't have teeth enough in there. We'll fill that in. Now with the springs pushing that in, we've got this in here. And he said, well, I can't eat too good here. I said, that's tough. You're just going to have to tough it out there a little for a while. Now, you remember these were quite a ways apart here. And now these, all the bone is moving down gradually, moving up here gradually. Gradually, this is moving down, and this is moving up. And it can move slowly with nature without cutting it all up in pieces. And you couldn't stick it back together if you cut it in pieces to get it in the right position. You can do some of it. I'm not criticizing the surgeons. We have some excellent surgeons, and they know how to take care of somebody who's in a car wreck and things are just crushed, and they know a lot about it. But it is not necessary to take everybody like this, and you can do it orthodontically. It just takes some time to do it. The fee for it is so much less than the surgical fee like that. And to me, it's a lot better. All right, we're going through this. Now, that's the acrylic I put on there. See, we had another wire underneath here, and then here's a big daddy or a rectangular wire bringing it out. Same thing down on the bottom. Now, watch how these teeth move. They don't get any bigger. The teeth are the same size, the roots are the same size, the tissue around the tooth is the same. It just gradually moves down into place. And as it does, the bone goes with it, and the tissue goes with it, and the teeth will come down and close, and this will go up, and it looks perfectly normal when you get through with it. And this is the orthodontics of the future. And this is not taught in any school that I know of around. And some people may be doing some of this good stuff we call restorative dentistry through orthodontics. That's what I'm calling it, but it's the orthodontics of the future. We're sending this out. I did a deal last week. We got over 800 views on a deep, deep bite case. No other way on earth they could have come to allow this to move together like that. And nature can do it, but you got to work with nature and just put gentle pressure constantly in a certain direction, and the teeth just move and the bone goes with them like that. You don't want to go too fast. Now look at the bottom now, it's already like that. Now we're expanding the upper arch, and we're bringing the roots out with the teeth. You can see these crowns are staying pretty well level here, so this is going out here. And I'm showing you how to put the buccal root torque in there. On the bottom, we're torquing it too. We got a rectangular wire in there, lining it up. And here's down the line a ways. The vertical height and everything, you don't change hardly anything. And now we're about midway, and he's beginning to cheer up a little bit. And now we put plastic teeth in these gaps, and he'll go get another restorative dentist to come in and build some bridges for him in there. That cost him more than the orthodontics did. I didn't charge this guy all that much. He and I got to be good friends. Now here we finish this up. This is in '93 when we got the upper arch out. I've still got brackets on these teeth right across here. Now these teeth, he had a gap up here about that wide, something like that. So this grew down or moved down, but it didn't get bigger, longer, or anything. It just gradually moved into place. It looked like that. There's the way it was to start. There it is after we got finished. Start, finish, start. That was 88, let me see what, it was 94. And this is a few years after we finished him. That's 1988. That's 94 again. 88. Look at the size of this arch when we started. Look where it went when we finished. Like that. All right. There he is at the time we finished. He's smiling. And he's got teeth. You can see him all the way back in here. He has lived 50 some odd years of his life. Now he'll keep these to the day he'll have them with him when he goes in the grave, I'll tell you. And there's a happy man for you. Now, this makes me happy. Did I help him so that I would be happier, or did I help him so I would make him happier? There's some both ways. This makes me feel good to be able to take somebody like that, and that is the beauty of orthodontics. And I wouldn't take anything but having had a career in orthodontics and spend my life with it. And that's what I want to get across before I go. I feel like I've got one foot in the grave now and another on the banana peeling. And I'm 96 years old, and I'm still trying to teach this, and people all over the world can see this, and they want to have this done. So I hope this goes out. Somebody's going to have to pick up the ball and run with it. They do not teach this, as far as I know, in any orthodontic school. There may be some that's beginning to, but this was not taught. And there's a world of this stuff out there that needs to be taught. I'm going to run through his x-rays real quick. I'm sorry I didn't straighten that tooth over to the side. His joints worked fine. And that's it. We've got a few better pictures here. And you would look at this and say, this is impossible for me to do. If you know how to do orthodontics, you know how to expand the arches, you know how to rotate all the teeth, you know how to make the roots go with the crowns, and there, all the pieces are there, and you can do this as well as I can, right here. And I just thought it up. A lot of times I run into a question of what can I do here to fix this? And I think about it. You think I'm crazy, but I think, God, how can I do this? It seemed like it just would come to me, how to do it. And so I did it. And I worked at this until I was 88 years old. I got to where I couldn't do the stuff that good. And so luckily I found about YouTube and Facebook and the other ways of passing this information on to everybody in the world can see it now. And this is the way the future of orthodontics is going to be. And you can write it down. I'll be dead and gone. I've been showing this for 50 years, things that we did way back there. And it has not caught on like I think it should, but I think people will see now that we've got it spread all over the world, and they will demand that it be done. So here we've got this guy. There's where he closed, and when he opened, you can see the difference in it. and here's the finished man, and he's happy, and I'm happy. I mean, this gives me something to live for, and everybody needs something to live for, and that is something that helps me as well as it helps him. And I hope that this catches on, and people that are in this kind of situation can be helped wherever you are. And I'm sorry people write back and want to know, where can I go to get it done? We have some people at the AOS that are trying to get to going to doing this. They do the minor stuff, but this is tougher material. But it can be done, and you never get too old to have it done for yourself if you find somebody. And that's the end, and I'm going to say goodbye, and I'll come back again later. Thank you now for watching.